All right, it's 9 o'clock. I call this Sawyer County Public Safety Committee meeting to order. Can we have a roll call, please, Madam Clerk?
Ron Buchholz,
Present.
Mark Helwig,
Here.
Jeff Haney, Marshall Savitsky, he's online. Jim Evans,
Here.
you have a quorum.
Okay, Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, certification of compliance with open meetings law.
This meeting was noticed to the public and the news media as required by section 19.84 of Wisconsin statutes.
Okay, meeting agenda has been presented and we were requested to change the agenda from number 13 wants to go before circuit court because Mr. Fremmel has a meeting. So I'm okay with that. Is the committee okay with that? All right, we'll move that up to number 13 up to, that'll be number 8, but, so, okay. Public comment? Linda?
Good morning, Linda Zolmer, Edgewater property owner. I wanted to speak to 3 agenda items today. Number 1 is the report from the code enforcement officer. After April, the county committees and the county board will have a chance to look at things fresh and maybe reevaluate some things. As I've looked at the code enforcement officer position, I noticed that there's little time between animal control and then taking care of matters in HHS and zoning. Other counties, and again, I recognize Sawyer County best practices in other counties, but then I also like to recognize other counties like Washburn, who their zoning administrator gives a monthly report on warning letters, citations issued, as well as court cases from the enforcement side, and it's all handled within that department. And I noticed that a lot of the code enforcement officer work lately has been involved either in water testing or now writing policies for the tourist rooming house ordinance that was actually adopted like last September, which those policies probably should have been written in conjunction with the ordinance so that everybody knew that they would work well together. Then the second thing is want to recognize that law enforcement and emergency services are they require the cooperation of both local resources and the county resources. And the better communications between towns and the county, the better the public is served and it's easier on them as well. I would like to take this opportunity to, being that it's the end of a town board term, recognize the town of Draper, who has really helped move the needle. And unfortunately, it's been by a lot of pushing to help identify where there were issues with emergency communications that are now being addressed by the county for their foresight in installing a helipad to better serve the residents in that far corner of the county. And then also with being successful in getting an IPG grant, an innovation planning grant, that is helping towns look at ambulance services, which leads me to the last item, is that Edgewater has always been served by the Birchwood Four Corners Emergency Services District. It was not included in the 2017 ambulance study that the county did. And it's been many, many years that this town and now Sand Lake, they're trying to look out for the interests of their people as far as what is the best option for getting ambulance service on a timely basis down there. And with the reports that are being turned in by ambulance, I cannot find a complete ambulance report for 2024. And the reports still do not include the number of ambulance runs that are actually serviced by the Birchwood Service, Great Divide, and other ambulance services. I don't think this committee has seen yet the pay grades for EMS that might help provide a clue as to recruiting and retaining people, as well as the burden on relying on fire departments to assist. And looking forward to you giving Sand Lake and Edgewater an opportunity to speak later. Thank you.
Thank you, Linda. All right, does anyone else want to speak on something on public comment that's not on the agenda? So, Is anybody online? Okay. All right, number 7. Consider approval of the minutes from the previous meeting. Anybody want to make a motion?
I'll
to
make a
approve?
motion.
Okay, we have a motion by Mr. Haney
Second.
and a second by Mr. Helwig to approve the minutes from the previous meeting. All in favor, say aye. Aye. All opposed, motion carries. All right, now we're gonna move over to number 13, emergency services. Mr. Fremmel?
All right, well, as you can see in my report, right now our actual average response times are actually dropped a lot. They're 11.54 minutes right now. I've been implementing that third crew, the 24 hours that we've been utilizing with part-timers as part of that experiment that I've been telling you guys about. It's been working really, really good. Working with Mike Margaret, I'm planning on around June, it should be the 6 months. And then by July, I should have a report that says, hey, this is how much, whether we're gonna have to, go forward with this, if this is something we want to continue. Also, maybe have a little bit of other plans involved, maybe about a roaming or different stations by then. But I want to get as much information in first before I even make any of those decisions, so I can bring it up to you guys, say this is what it's going to cost, this is what, we're seeing, and the townships and how like the summers and where the crews can be stationed, if that's the way that we want to go, right? As you looked into my city, town, and villages breakdown, you can see like so far where most of the runs were. I've actually started to include like when we do our intercepts and where, and if we're out of county, what township that we're responding to, when we do go out of county. The other thing that I need to start putting in, which only is one, is the Bass Lake Washburn is technically considered our coverage area because we do have a contract with them. My whole goal with the EMS responding per unit is to even out the unit 1 and the unit 2 responses. Unit 1's always going to have the most responses, but I want that gap to be closer, because that means that we're having multiple calls and that second unit is actually responding, which is making our response times a lot quicker and turnarounds from the hospital a lot better. I also broke down the types that we do, what kind of, obviously most of our runs, are 911 response, when we get paged, and then how it breaks down from there. We do blood draws for the jail. So like whenever you see like North Medic and stuff instead of a unit, most likely that's for just the medic to come assess someone or do a blood draw at the jail. The 26th of March, we're doing a Stop the Bleed at the LCO school. We've invited all first responders, fire departments to come with it. It's going to be taught by our Thames medic, Logan Peterson. Plus then we'll have our monthly meeting at that time. Our brand new ambulance is almost done. It's at Conroy's right now getting it should be done by the end of next week, he said. And then I got to start ordering the stuff to get that back and put in service. A little bit of bad news, we do get these video laryngoscopes. It's to help us with intubating in the field. Well, that company's going out of business, so we're gonna have to switch to a different manufacturer. Each unit costs about $2,000, and we have 7 ambulances, so that's something I've been talking with Mike Margaret and Andy about, and coming up, that's gonna be a cost. I've had a couple vendors come up so far to demo their things and see what price we can get, the best price, the better. And then also, due to some shortages, the company that does our maintenance on our stretchers, they're technically not out of business, but they don't have enough people to service us. So right now, actually, matter of fact, today we're getting all the serial numbers and stuff and together to send to Stryker to set up a contract with them to do the maintenance on those. I'm not gonna get into the billing things. If you guys have any questions about the billing, let me know. But as you can see, my medical examiner site is now up and running. I'm able to start doing these things. It's not gonna be 100% accurate yet because I'm still training my guys on how to utilize the system. It's a cloud-based system, so they're able to do their reports at home or on scene. So that should be able to help us with more accurate report keeping. But like right now, we're under training, so it's basis of what we have right now, but some of the information might not be totally accurate as of this report, which I'm hoping to have fixed by next month.
Okay, I got a question for you, Mr. Fremmel.
Okay.
Is it possible for you to draw up something for this committee to take a look at on wages for your EMTs and stuff, so we can have a look at it too? Andy, is that possible?
Yeah.
Huh?
Yeah.
You have that?
Yeah.
Okay. I guess I didn't see it, but,
I mean, you're just asking to see the wages of each individual employee that we have on staff, or the wage rates for?
well, the wage rates
Yeah.
would be my concern. I mean,
Yeah.
okay, all right. So, Mr. Fremmel, before you leave.
Yep.
I believe the update and discussion with the towns on the ambulance, that would be bringing in Mr. Langham and Mr. Baraboo.
Okay.
So I'm gonna ask them, they can speak now while he's still here. So whatever one wants to speak for,
Oh, okay. Our representative is here.
okay. Well, we're gonna go on to number
Yeah,
seven.
and in fairness,
Or a number.
Attorney Kelsey, right?
Yeah, I seen him go by here.
Yeah.
Is that what you're waiting for? Mr. Kelsey?
He had asked about what time this be on the agenda, and I told him it would be about a half hour.
Okay, all right.
Based on the agenda,
Okay.
he called the other day.
All right, so number 8, Circuit Court. We don't have any judge here. Are they in court today? I take it?
Yeah.
They are? Okay, you want to give us an update, please?
I don't have a report or an update. Judge Yakla is in court and Judge Isham is at a meeting at the school. But we did have a turnover in staff. Anna is no longer with us. She accepted a new position out at LCO. And Judge Yakla hired Christy as his new judicial assistant.
Okay,
So
have any questions? Mr. Evans, any questions? No? Okay. All right, number 9, Clerk of Courts report. Marge?
Good morning. Sari touched on the changes in staffing. Miss Christie has left our office. She was our civil small claims clerk and probate, and she did a phenomenal job. Judge Yackel made a very wise decision in appointing her as his JA. She will do a great job for him as well. We sorely miss her in our office. With that, we are now looking to fill the vacancy. I would also like to let you all know that on Monday, the 10th, the 10th Judicial District Clerks of Court will be meeting with Senator Romaine Quinn here at the courthouse regarding additional funding that's being requested through the Wisconsin Circuit Court, Clerks of Court Association and the Wisconsin jointly with the Wisconsin Counties Association. I'm going to let Andy touch on that. And I just wanted to let you know that we're down to 1 3-day jury trial in the month of March. The others have resolved. So any other questions on my report?
Any questions? Go ahead.
No, I just have a question, Angie. Are we still gonna go ahead with this resolution, even though this gentleman's coming?
What did he say?
Yes, I mean, you want me to just I can do it pretty quick.
Yeah, go ahead.
Yeah, so in the packet, like Marge just mentioned, one of the topics that the Clerk of Courts Association as well as Wisconsin County Association have been working on. And actually, the County Execs and Administrators Group, the one I belong to, that was one of our priorities last year. There was a number of meetings held reviewing the circuit court funding and how much we collect versus how much we send to the state and then how much it costs us. So if you look, I'm going to scroll down on that one to the next page. So this is the, it's breakdown for the whole state where you can look like last year. This is the revenues generated by circuit operations. So this is all collected at the county level by the circuit court, clerk of court. The counties last year retained 28 million, and then we sent to the state 107 million collectively of all the fees and forfeitures. Then you look at the state expenditures, how much the circuit courts cost. It cost $141 million at the state level. Of course, they were offset by 107 million in revenues. And then you go down and look at the counties expended 237 million, and we only retained 28 million. So what the point is that our cost to operate the courts continue to go up and up, and we're still sending more and more to the state and not retaining that revenue that could offset it.
Okay.
And I guess the other thing to point out, not many people realize that it's Sawyer County Circuit Court. Really, though, it's a subdivision of the Supreme Court. It's a state court. That's why the judge is paid by the state, the court reporter is paid by the state. We're operating it for the state. And then we pay to staff it, and the JAs and the clerk of court staff are all paid for by the county. So the request is for the state to basically fund more of their own court costs.
Okay.
And that's what the resolution goes to. I was in Madison for this CAP team last month, and this is what we met with the legislators on as well.
So you're okay with that?
Yes, I think the resolution, it's in the, if you follow the budget process, it's in the governor's budget. He did increase the circuit court funding, but more than likely that budget will be set aside by the legislature and they'll create their own budget, which should come out in the next month or two.
All right,
We need a motion.
need a motion.
Yep.
I would make a motion to approve the resolution urging the Governor Evers and the Wisconsin legislature to support the county courts. Give us more, a little less.
Okay, we have a motion by Mr. Helwig. Do I have a second?
I'll second.
We have a second by Mr. Haney to approve the resolution urging Governor Evers and the Wisconsin legislature to support our county courts. Any more discussion on it? Not, all in favor, say aye. Aye. All opposed, motion carries to approve. All right, now we're gonna go back, we see Mr. Kelsey's here. Back to the update and discussion on towns and on ambulance service.
Thank you, Mr. Buckles, members
Yes.
of the committee and the public. I'm here on behalf of the town of Sand Lake and also the town of Edgewater, just to try and open up some discussions. Specifically, they were wondering if the Public Safety Committee would be willing to move forward with the county or recommend to the county. They're looking at potentially exploring working with the county so that maybe they could contract with their own ambulance services because of just the number of things that we've had, whether it's been efficiency, cost, or whatever. Now, I'm not trying to say that they're going to threaten anything, but this is the first step. Mr. Alvarado has given me, and we have talked very, very briefly, there is a court case that tried to do this back in 2017, which was the town of Grant versus Portage County. We're not trying to go to that. We're just wondering, potentially working with the county, see if that they could contract with the service with the idea that potentially then after that point, it could reduce the tax bill or the county, what the county assesses. There's, without getting into all of the statutory requirements. This is the first step. One of the examples is on with the town, Mr. Pete Baraboo and Mr. Langham are here from the respective counties, there's an ambulance service site for the town of Edgewater, less than 2,000 feet from their corporate lines or their line. And this is where they would like to try and start to work with the county. And that's where we're at. If Mr. Langham or Mr. Baraboo, if you would like to add anything else, that's our first step to see if you'd be willing. Yeah, actually. Sounds good. So I will defer to Mr. Baraboo. Thank you
Okay,
for your
thank you.
time.
Thank you, Board. Thank you, Mr. Chairman. As a town chairman and as a business owner, I completely understand numbers. I mean, I know we have to look at all the numbers, but when we're dealing with emergency services, we have to look at individual cases. And every time I keep coming up here, I have another individual case that didn't work out. And we had a situation about 6, 7, 8 weeks ago where we had 3 ambulances respond to a non-emergency. I mean, it was a car accident. This isn't doing any good for the county. This isn't doing any good for an individual situation down in our town. And I know we're working toward improving these situations, but every time we don't get it resolved, we have another individual situation. And we have a solution. And we would like to pursue this solution. We've been using the Birchwood Four Corners Emergency Services District for a long time. And I think since 2007, and it was Birchwood Ambulance before that. We're happy with our situation. We're not happy with 2 services. And I guess I'm just looking at this from an individual. I do not want to have any more individual situations. And we need to come up with a solution for this. So anyway, I just wanted to point out that we did have yet another one. And I understand. I understand that when you're dealing with 2 services, that can happen. But we have a solution. So anyway, I would just like to thank the board for letting me address everybody.
That's the one you were telling me about, right?
Yes, sir.
Okay, thank you.
Yep, thank you.
Appreciate it. Huh?
None of us know.
Yeah, I mean, do you want me to?
Yeah, go ahead.
Pete, if you want to stay up there, yeah, please. Yeah, and I'll try to fill in the details. Well, law enforcement was there as well. So there was an accident on Highway 48 east of Birchwood, east of F, right? Yeah. And so a car accident, slide-in or something along those lines. Anyway, there was multiple occupants of the car. Dispatch took the call, dispatched Birchwood as well as our ambulance. And so the way we had started working on this like a year ago was that any calls in Edgewater, their request, which they have, is that Edgewater gets dispatched, or excuse me, Four Corners gets dispatched first. We also dispatch ours when Birchwood Four Corners gets on the scene, determines what's going on. If they get there first, they call off our ambulance. In this case, our ambulances did not get called off because there was multiple occupants. Our Ojibwe ambulance responded, and then also the Hayward ambulance went. And so that's how we ended up with 3 ambulances on scene. Anybody want to, did I get that part right up to this
Yep.
point?
And then that other crew that I've been staffing was posted in the middle of the county while that was going on. So,
And then I guess there was more to that. While they were on scene, there was some, I don't know how to, kerfuffle.
Yeah.
Altercation, yes.
Yes, altercation. And I don't, if John wants to weigh in on this, but we operate a paramedic service. Birchwood is a basic. So our paramedic level is supposed to have not authority, but a higher level of care to be able to check the patients out. And that there's a disagreement on that, I guess.
so if we get on scene, and that goes for any, like, even if we called mine on in, the back, any of the smaller ambulance services, if for some reason a medic gets on scene, because we are the higher level of care, we're supposed to assess them. There was a little issue, and it actually involved law enforcement with, like, the ambulance just leaving. So,
The Four Corners ambulance.
my question is, the officer on the scene, did he have his body cam on so they could see what's going on?
There was body cam.
Yep.
There was?
Yes.
Okay.
So there was 3 ambulances that showed up, correct?
yeah, we didn't get called off, so,
Okay, so that was an error.
yeah, well, it was
Dispatched
multiple,
By,
the dispatch was there was multiple injuries, we didn't know how many.
okay,
So,
I'm
yeah,
still not catching
Okay.
your issue. I'm sorry.
Nicole?
You're saying there's an issue, and I understand 3 ambulances showed up, but then
What's the issue?
what's the issue from there?
Well, who's covering the rest of the county? We have 2 ambulances. we have a second ambulance we can dispatch. So you're leaving the rest of the county naked by having 3
Is
ambulances.
that the case, John?
No, we had, like I said, I had my third one was posted in the middle, so we were good that way.
Okay, and then,
Let's hear from Nicole too, Mark.
Just to clarify, 2 ambulances were dispatched, Birchwood Ambulance and Sawyer County Ambulance. Unit 1, I believe, was out on another call already, had cleared and were in the area. And based on the injuries or the alleged injuries at the time of the call, they went to assist, unknown of how many patients would have to be transported. That's my understanding.
Go ahead, you got more now.
well, my understanding from what everything was said here was what happened should have happened by having these other ambulances come in, because nobody called them off and saying, well, there was only 1 injury. So we've got, we have EMTs from the other unit.
Sir.
We got the life-saving guys here on, with our units. That's not the right verbiage, but, part is, I'm still at a loss of what, because you're saying, you're up here like, oh, there's an issue. I haven't heard the issue yet, I'm sorry.
There's an altercation.
What was the altercation?
I'm
Nobody's said that
missing match
either, and I
between two
believe as
different
a
units.
committee, we need to know what this altercation was.
I
Especially
wasn't
if the-
firsthand there. I'm hearing it from my
Okay.
team, but there's an altercation in front of patients. I don't know who caused it. I don't know what it is, but nonetheless, it happened. It's an
Okay.
individual case that our ambulance felt they could handle it. They have a second unit. We need to avoid these altercations. I don't know what the issues are between the 2 units, to be honest. But
And so I don't remember if you were there, Pete, but like a year ago, or approximately, Ron and I, John, Vince from Four Corners. Were you there? There was 2 people from.
I believe
was there
so. I've been at
Pete,
a
okay.
lot of meetings.
So that, yeah, I was at the fire hall. We had altercations, or I don't say altercations, but maybe scene issues between our ambulance services a year ago. So I thought we had come to an agreement about, improving radio communication between the ambulances so that, Four Corners responds. If it's not a paramedic level call, they can call us off. We turn around and head back if we're not already there, to make things covered. We've had a couple, that altercation. There was another issue with Four Corners responding to a call, bringing a patient to Hayward, not intercepting with us when I think they really should have, coming through the county emergent without notifying our dispatch. So we have occasional issues between the services, and it's not between Edgewater and Sawyer County. It seems to be more staffing at the staff level when they interact with each other.
Okay, I just got one last thing to say. From what I understand, when these individuals got on site, since Hayward, Sawyer County was not called off, they were the higher authority on site, or as the medical staff goes. Since, like I said, since they were not called off, when they got on site, they were the higher authority. And from what it sounds like in the past, there had already been agreements made that if they're on site because of that, they would take over. So there shouldn't have been an altercation at all. And so it sounds like these staffs have to get together and figure out what's going on. And I come off as kind of rough at times. I apologize. So it sounds like Andy said, a staffing situation. But it just seemed, when you came up, it was like, oh man, there's this issue, and it took a while to get to the issue. And I believe this committee needs to know these issues. We shouldn't be finding out from, we shouldn't be finding out from somebody on the public. Sorry.
Okay,
We
but
need to know these
in my
things.
defense, Mr. Buckholz was aware of this.
Yes.
So, I mean, this is something that we addressed at the beginning right after this happened. So
I let Ron know as well.
Blindside everybody here.
And we sat down, we sat down kind of as a team with the sheriff's department, EMS, after this happened. We had a couple calls we had to review and talk to the deputy that was on scene to get that,
Okay, I'll
And save,
discuss this offline.
and I did ask Tenant to save, earmark the body cam footage in case we need to revisit it. The bigger issue, I think, what Mr. Berg was talking about, though, is he's concerned about the use of resources, basically. If they were already subscribing, paying a fee to the Birchwood Four Corners to cover Edgewater, and then, still having Sawyer County units respond, it doesn't feel that's the best use of resources. And then we've had that part of the conversation before.
Yes, sir.
And if I could just take a step back to Mr. Kelsey's comments. So they're not asking for, towns already have the ability to tell dispatch which fire department gets dispatched for their township, which EMS service. So Edgewater has given directives that for all of their fire and EMS calls, Four Corners gets dispatched. Now I believe Sand Lake is looking at doing something similar potentially. They have the prerogative to do that. I think what they're really asking, though, is that somehow they not be a part of the levy for EMS at the county level. That's the part there's case law on. It's a countywide service and probably should have had, I know how towns look at it. They look at, okay, and even in our levy breakdown, we show the EMS levy as a separate levy. It's part of the total levy, but it is separated out because the state requires that. So you can look at it and see this township pays this much levy for EMS, and they might look at it that we can somehow subtract them out, and really we can't because it's a countywide levy. Now, if townships want to go their own direction, we can just get out of the business and they could each, figure out which service they're going to go to and pay a fee to them separately. But we can't just say, okay, you're not going to pay the levy for EMS, which is really the bottom line.
I just want to be on the record that I understand that Sand Lake pays an awful high levy for their area.
Both Edgewater and Sand Lake are
Very,
valuable townships. They take, if you look at any of the services the county provides, they pay a larger portion because their townships are, Sand Lake is more valuable than Meadowbrook or
Lots of lakes.
Meteor.
Come on, Andy.
Yeah, ouch. Well, and I've used the example like libraries. The town of Edgewater
yeah.
pays a
well,
larger chunk of the library levies, and I'm guessing the Edgewater residents probably aren't going to many of the county libraries either.
I guess, Edgewater takes Birchwood Four Corners as their EMS priorities. Why can't we honor that?
We do.
But why do we still have these confrontations with Sawyer County ambulances? And there's got to be a way to work this out. Maybe do we need to get our corp counsel in and talk to Mr. Kelsey and the town of Sand Lake and them, or what? There's got to be a way to.
Our
keep
council
this from
met
happening.
with the town of Edgewater council a year or two ago. We had, was it your council or was it the towns association council? I think it was the towns association.
I think it, no, that was our attorney.
Was that your attorney?
Yeah,
Okay.
Lee Trini.
Yeah, we kind of had the same conversation about the levy. Now, as far as if you were saying just Sawyer County doesn't respond to any calls in the town of Edgewater, that's a liability for us to not respond.
Yeah, I see that too.
So-
Mr. Fremo?
I have a suggestion. Sorry.
Well, me and Nicole, and we've actually been talking about this for a while, is like, what happens is, and this is not just Birchwood, it's like a lot of the smaller ambulances, when they come into Sawyer County, they're not communicating with dispatch. If they're coming into our county, if we can hear, because I can hear Sawyer County on all our radios. If we're dispatched to a scene down in Edgewater and Birchwood is communicating with our dispatch, then we know what's going on. We can hear them talking on the radio. We can, because there's a difference between a 2-car accident with no one injured or a 2-car accident and limbs missing, right?
Yeah.
And that way that communication is better. If we can improve that communication, then the resources that everybody's talking about we can allocate those better, but when we go in blind, not knowing anything, we're going in a 2-car accident, you always go assuming the worst, right?
Oh, yeah.
Someone got ejected, someone got rolled over. The other thing is that, we were volunteer forever, right? And if you guys remember, being a volunteer ambulance service or paid on-call ambulance service, you're not guaranteed someone to respond, right? So if we know that they're coming and they know that they're having a full crew, right? Now, are they going full-time? Are they guaranteeing response times? I don't know that. But we know that if that becomes a thing, what happened to us when that happened, right? So there's a huge, big thing that opens up when you start going into other areas, start saying that you're guaranteeing things. And that's what we wanted here because we were faulting on a lot of that, where Hayward was running out the winter and winter would be called to come to Hayward as volunteers because we would page and page and page. So now we're at the full-time level. We're guaranteeing out the door. We're guaranteeing responses, at least trying to respond. And we do have mutual aid agreements with everybody around us. So if we are full up or if we are hurting, we do call in other people. We work very well with dispatch. So if we can start requiring or at least politely asking these other services that are around us, like, hey, if you're coming to Sawyer County, talk to dispatch.
They have the capability, don't they? Let's see what's so hard about that. They don't, so.
Well, I know this has been going on for quite some time. And
Well,
we need to do what we got to do to make everybody happy. And if it's something that dispatch can do to make it better, well, then that's what we got to do. But we've got to get along with Birchwood and Edgewater, and we got to do something to make this work in everybody's favor. It's just, and it's the only two problems that we have is Sawyer County and Birchwood Four Corners that I know of. So, and being on chair of the safety committee, I would like to get this fixed so we don't have that problem. Go ahead, Mark.
Andy, no, they kind of want to secede, I guess, from the county ambulance service. If we were to let them do that, I mean, how would that work? How would that, is that even possible? Because then
I mean, they can choose to have whoever they want service their township.
Liability.
Well, they still can choose. I mean, if Sand Lake wanted to sign a contract with the North Memorial to cover that, they can do that. But if North Memorial doesn't cover it, then we're responsible to cover it as a county service. So we'd want to have the same type of arrangement that the same thing we want with Four Corners. Either they're not making the call, we are going to finish the call, or if they get there and don't need a paramedic, we can be
We have to
called
go,
off.
we have to go unless we're called off,
Right.
plain and simple.
That's where we're at.
It's a county liability if we don't go.
Yep. And
So,
from a financial
They have
standpoint,
to.
we can't let them out. And if honestly, if enough towns said, I mean, if we were, when we've had this conversation with Edgewater, by us saying we're not going to service you, it doesn't change our business model. We can't reduce our costs. Same thing with letting Sand Lake out, not servicing them. I mean, not just saying we're not going to do their calls. And I don't know, I don't know if we have good numbers on Edgewater because we dispatch Four Corners, but in '24, we recorded 20 calls in Edgewater. In Sand Lake, it was 73 calls. Taking those out of the mix is not going to change the level of, like, the number of ambulances or staffing that we're going to have. Now, if enough towns said they're going to go, I mean, at some point, there's not that critical mass for the county to operate it, and the towns will all need to figure out their own ambulance service.
But the thing is, the towns, even like you said, if they wanted to, they can still purchase or whatever, another company, but we would still have to service that area.
We'd have,
no
we have to make
matter
sure,
what.
we'd have to make
Unless we
sure,
disbanded our.
we'd have to make sure it gets serviced.
Yes.
Yes.
Well, it's just like when towns start their own police force, right? You know,
We still-
the sheriff's still responsible
No,
for what
still
happens
that.
in it.
So in Edgewater, you know, call wise, yes, it does take us 20 minutes. You know, we didn't get to a call into Edgewater in less than 20 minutes of the ones we respond to, unless, looks like one, but I'm guessing we might have had an ambulance in the area already. Sand Lake, calls, we average 18 minutes. And those range from 5 minutes to, the longest one last year was 41 minutes.
I
Our
lost
response
the-
time to
the
get on
area
scene.
Here, how many like go to that area, but, do you, John, do you put down, cause it's like one or, it's only a couple that you have on your report for those areas, as far as being, those are just runs that you actually go there, correct?
These are our runs.
I mean,
Whether we got on scene or not,
yeah,
I'd have to go through the 30,000 data points and find one that does the scene time.
well, I guess we kind of need to know that as far as how many, you get called, a call there and then you don't go, or that you go.
So we do reports for everything that we do. So whether we get called and canceled, like I could put in the canceled ones and stuff like that. But that could be, or called off, or I can find those numbers. It's just, you know, digging through the data points to find what they are.
I don't
There's-
expect
there-
you to have it next month.
There's a-
'cause
there's a-
It sounds like a pretty big task, but
Well, I can,
it sounds like something we need if we want to really resolve this issue. We need
Yeah.
to know that, like anything, you gotta have data.
yeah.
Well, and honestly, I don't know, I mean, there's the financial issue that the towns are talking about.
Right,
I think Mr. Buckholz is talking about is the relationship.
right.
And to me, it's, I mean, the Ojibwa ambulance responds to average one call a day. And, you know, on the rare occasion, you know, it might have two, and we've had situations where they come at the same time and we have to, you know, ask for mutual aid, which quite frankly, any outside of that area of the county, mutual aid to the north and the east is not really there. Like, it's not reliable. So, where was I going with that? Oh, it's not a big deal to me that Birchwood, Edgewater, or Four Corners responds, and if they don't need us, they call us off. If they need us, I mean, if we can provide service, we can provide care that they can't, let's be honest.
Right.
And it's not gonna be on all calls. I don't think it's a strain on our resources to do that.
Well, that seems like something we gotta do.
But
I mean, if
as
they
far
get
as the-
dispatched first. but
Yeah,
then-
as far as the relationship, this is where I'm at on it, based on what we've had happen earlier this year is there is a state agency that deals with EMS. And I think we just need to sit down with them, like, have them in the room, the Birchwood service providers and ours, and get down to brass tacks about, you know, when there are two ambulances on the scene, make it clear whose care is supposed to be provided, you know, who does the transport, and get, I don't know, I mean, we did this a year ago and it somewhat improved it for the year, but then we have another call where we have, like Mr. Burbu said, we have an issue again.
Is there different people on now or?
Well, yeah, it was different people. The one medic that kind of had, that he actually took issue is he's actually a flight nurse for Guardian. And he was none too happy with what happened there.
So
So,
he might have believed that he had,
well, he works for us. So,
okay. But this, I agree with Andy. It sounds like something that you all need to get together and figure out, then come back and report to us and let us know what the deal is, okay?
Okay, I just have one more thing I want to add
go
to.
ahead.
It's not, the other portion of this that has been a very big concern for Edgewater is just logistics. And I mean, it took me 35 minutes to get here today. And I'm about not even a half a mile from the town line, on the Birchwood town line. So it's about 35 minutes. Ojibwa, you can Google Maps it. It's 30 minutes. And it's just, that's the other part of this that we're concerned about is just response times. And, it's different with police because we have officers coming through the area all the time. So there's, typically a call has pretty quick response time because there's usually somebody in the area unless they're got called to a different area. But ambulance in most cases are stationary. And if they're not being called and it's just, so that's the other part of it that we're concerned about. The money we pay for something that in a lot of cases is, just pure logistics, 30 minutes response time. So anyway, but anyway, I appreciate it. If anybody, yes, sir.
I just, don't go anywhere.
Okay.
There's something else there I wanted to get to, which I guess plays into all this. So, and I wanted to make the committee aware, this goes to response times. Mr. Fremmel was contacted by Strategic Management and Consulting. It's a consulting, Dana Seckler there. So the towns of Draper, Edgewater, Meteor, Round Lake, Sand Lake, Spider Lake, and Winter applied for an innovation planning grant through the state, which is part of what was passed with the shared revenue increases a couple years ago. And they are contracted with them to do a plan. They're looking at radio issues, emergency communications, clarify how towns are paying for EMS, for investigating the need for provision of non-transporting EMRs. And then they're looking at decreasing ambulance response times, best way to measure service, assure best uses of EMS for EMR, EMT, AMT, and paramedic, et cetera. So this is kicked off and the consultant got a hold of John because they want, information relating to call volumes for 03 and 04, incidents by day of the week, time of day, response times, and then looking at number of staffing levels, equipment, and all that. And I'm not, John's talked to the consultant, I talked to him, we're getting him the information, but, and I'm not sure how much of this is the fire department or how much you're looking at EMS. We're not a part of the study, so to speak. We're kind of, I don't know. I'm a little confused because and I told the consultant,
County,
the planning grant,
should be.
the planning grant is supposed to look at how to achieve a 10% savings by consolidating or sharing services. And it's only eligible for municipalities less than 5,000. And the intent is for help those put together a plan. So eventually there are going to be grants given out to municipalities and counties to consolidate and share services if you can achieve that 10% reduction. I don't know, we also have maintenance of effort requirements that because of the shared revenue, the towns with fire departments or police services, the county with the sheriff and EMS. Last year we had to certify maintenance of effort that we're getting additional shared revenue from the state. We have to maintain our, either you can measure by staffing levels, response times, staffing, response, and expenditures. And so I don't know how you can maintain your effort and still try to achieve 10% reduction. But I just want to make everybody aware that this planning grant is ongoing. Like I said, John talked to Mr. Seckler. I've talked to him, went through the information he's looking at. I don't know if this is going to help us find answers to the response times and location of our bases. This is the same company that did the 2017 study for the county. The person who did it is not with them anymore. This is a new guy. He wasn't aware of the 2017 study. He wasn't aware that it's a countywide service and that the county's paying for it, not the town. So it could help us get answers, or it could help us, or it could create more problems. I don't know, one or the other. But this is, that's to Mr. Burbu's question, that study could lead to hopefully some answers or some clarification on acceptable response times and locations and staffing levels, that type of thing. Or that.
All right.
I mean, we pledge our cooperation. If I could just segue off of this for once, since Pete drove 35 minutes. And I think this is applicable to this committee, so I want you to bring it up if you would. Last town board meeting, I understand that, do you have some unhappy residents with sheriff response to VRBOs and animal control and,
Oh, well, yeah, that's a,
I mean, if I could,
Yeah.
yeah.
as long as you're here, I might as well bring it up.
Okay, first of all, let me premise everything here by saying that we did not have time to do any kind of research into this. This is taking someone at their word. So we apparently have a vacation rental on Sunset Beach that the neighbors have called numerous times and there's never been a report filed. I'm not sure if these responses, or maybe the call, I don't know if the calls going in maybe didn't warrant a report, or if something happened. I'm just taking the residents at their word on this. And again, I have not had time to do the research and follow up on this, but so anyway, apparently there's been numerous calls. Someone tore up a yard and there was never a report filed. So I don't know. I'm just bringing that.
Yeah.
Everybody's
I
attention.
know it came up. I heard about it from multiple places.
I heard about it.
Yeah, I know Ron heard about it. I know you're probably frustrated, but I appreciate you being here. I wanted to give you the chance to
Oh, yeah. Well,
talk about your experience as a town board chair.
When it comes to vacation home rentals, people either like them or they don't. And sometimes when you don't like them, sometimes the disturbances are maybe magnified in their mind. I'm not saying it was, I'm just saying that I can't just take people at their face value and what they're telling me. So what we've done is we put together something where they can call our local police officer, and they're going to work something out amongst themselves. And he's going to kind of do some research into how serious these claims are. So that's where we're at with that right now.
Okay. Sheriff.
I would just like to say that I did receive an email from somebody who, it sounds like, attended the meeting.
Okay.
And they were summarizing from their perspective whether it was an agenda. Otherwise, I don't know. I wasn't there. And with that, we will offer putting a further fact finding together, and we're happy to present before the town board on the facts of what we have, on what our dispatch received, what our deputies responded to, and give a complete layout on what happened, everything from responses to any follow-up afterwards. We're very transparent and we're happy to do that.
Thank you. Appreciate it.
I will add to the board and to you, sir, that we did reach out. Actually, Chief Brunlick reached out to me, and we did compare some notes and we looked at some of the cases. So he is in the midst of that right now.
Okay, perfect. Thank you.
Okay. Any more questions? Oh, yes, go ahead, Jen.
I'm the code enforcement officer, so I deal with like the animal calls that were down there, and I'm working with environmental health with the TRH aspect of it. So I kind of know what you're talking about and all these complaints, and we are aware of all of them. The trespassing, the dogs at large, all of those. That's kind of why, and I was going to talk about it a little bit too in my report, but this property is the main reason why we're coming up with the policy and procedures and how we want all of that to look, since with the new ordinance and everything, we don't have that yet. So with the new ordinance, it's a little bit more, with the calls of service and all of that kind of thing, how that's gonna affect the complaints and that kind of stuff. The dogs at large is a little special with TRHs and Airbnbs and VRBOs, just because they're different people there,
Correct.
more often. It's more, so I don't issue citations on the first complaint of it, because it's for the owner that needs to keep control of their dogs, which if it's the same person multiple times, they'll get a citation, and then we can do further about that kind of stuff. But for I know the trespassing and that kind of stuff, that's what we're working on with the owner of the property, and we have been in contact with the owner of the property, and we are, trying to get, I guess, policies in place from him, how he's handling it, if he knows about it, that kind of stuff. So we are working with him to also get it resolved for that specific TRH too.
Perfect. Well, what an honor. We're the glaring example of a vacation home rental, so. But, yeah, so anyway, this, I actually, the first time I heard about this situation was 3 weeks before our last meeting. So we were not aware of anything going on there. It was just all of a sudden we want to be on the agenda. So, and we just haven't really had a lot of time to follow up with everything yet. So
And that
I
happened.
appreciate it. Yeah, yeah.
All right, any more questions for Mr. Bearman? All right. Linda, quickly.
That the understanding of, I don't think the county has ever been able to demonstrate that they established a countywide ambulance service, at least since the 1960s. Edgewater has always used Birchwood. And so this idea of a countywide ambulance service, I think, is the question in mind. It's not that Edgewater even understood it was under countywide ambulance. And when annual assessments went from $3,000 to $80,000 when the service went full time, is when Edgewater became aware of paying both for the service they get as well as the county service that is not the primary provider.
Okay, all right, thank you.
All right.
Mr. Langham, you want to speak on anything, or Mr. Kelsey? All righty.
One of the things that the town of Sand Lake is a little bit different, as we said, because they're first exploring this, is the possibility of maybe working with the county on a contract under Chapter 59. You can reach contracts with maybe be a subcontract agreement through the ambulance service for something that would service town of Sand Lake. It's just a thought. We wanted to explore that going forward. And if you need some time with this is just the first step to try and work with the county on that. So that's where, to let you know, that's what our thoughts were.
Okay,
Thank you.
all right, thank you, Mr. Kelsey. All right, and Andy?
Just, we'll step off of that as I can quickly, I can blow this up a little bit. Since it was asked, hang on. There we go. So our wage grid. So our EMTs are at level F. Let's see, F, J, and H. So J's are paramedics. H's are advanced EMTs, and F are EMTs. And I'll scroll over. All of them are at the far.
It's not moving.
There. Yep. So our paramedics are all going to be around $30 an hour. Our AEMTs are in the mid-20s, and our EMTs are at around the $20. Based on their length of service, they're all going to be different, but that's roughly where they're at.
Okay.
Now, this does not include our on-call, because we don't really have any on-call anymore. Not because we don't want them, but
Nobody wants to play.
right.
Okay. All right,
But I'll email it out so you can take a
yeah,
closer look at it.
appreciate that, Andy. Oh. All right. Any more? If not, we're gonna move on to number 10. Sheriff's Department. Thank you, Mr. Langham and Mr. Baraboo. Okay, go ahead, Lieutenant.
Thank you, Mr. Chairman. You can see our patrol call volume has dropped again from where it was last month to 581. The 3 months trend shows December being 660 and January being 643. This month is also decreased from 24, where we had about 827 calls for service. For the reporting period, Sawyer County deputies have issued 46 citations, 11 written warnings, no traffic citations, and per community maps, there were 21 total crashes, 2 with personal injuries with no additional fatalities to date. We ended out the seasonal festivities for the 51st Birkebeiner, no major issues. And we always like to thank our community partners, including the City of Hayward, LCO Conservation, Birchwood PD, Wisconsin State Patrol, Department of Natural Resources, the Bayfield County Sheriff's Office, and U.S. Forest and Park Service. It seemed to mesh really well this year. I think we're finally getting the hang of it. And everyone had a really good time. We also started pre-patrol orientation for 3 of our sponsored students, Deputies Madison Waller, Michaela Kosterman, and Nick Pompuch. They'll be getting an overview of the patrol work agency setup and asked to assist with special duties and assignments as they get ready for the respective law enforcement academies this year. We hope to have 3 working part-timers then by the end of the year to help fill shifts. That concludes my report.
Okay, nice report, Lieutenant. Any questions for Lieutenant Lipinski? Okay, not. All right, number B, jail report.
Thank you, Mr. Chairman. The average daily inmate population for February was 55. This is compared to 71 of last February. We averaged 13 females and 42 males. 22% of our incarcerations are probation incarcerations, 58% are pre-sentenced, and 20% are sentenced. We currently have 3 on electronic monitor with the current inmate unemployment rate of 72. The jail is currently fully staffed, and we have our last 2 full-timers attending the jail academy as we speak. They're in their 2nd week now, so
Good.
we finished up in 2 more weeks.
Okay, good deal. All right, anybody have any questions for the Chief Deputy? Not? All right, number C, code enforcement. Chad?
Thank you. So for the revenue for animal control has been mostly the county dog license, which is to be expected. And then some pound admissions, but we didn't have a ton of admissions last month, which is good. We had about 9 admitted into the pound, 4 of which were released back to their owners, and then actually 4 were released to shelters or rescues and whatnot, and 1 did have to be euthanized, unfortunately. As for calls, animals at large or dogs at large continue to be the top one. As for environmental health and human health, we are working on those policies for the TRH complaints now that the new ordinances are being implemented and whatnot. And we've been working on that for a few weeks, and that should be finished probably within a week or 2 here. And then we'll be better addressing, the complaints and all that for those, and have a new program for complaints to be entered into for us to receive. And then, we are working on, with the owners for that Sunset Beach one that they were talking about down in Birchwood. We are working with the owners still to get, better practices in place and hopefully have those complaints resolved as well.
Thank you. Any questions? Why was 1 euthanized?
So she was surrendered. The owner passed away and the family did not want the dog, so they surrendered her to us. However, she was very aggressive.
Oh,
Yeah, she wouldn't let anybody come near her, even if we looked at her, she would growl and kind of snap at us.
Okay.
So unfortunately, no Humane Society would take her.
you take her, yeah, okay.
And she was older, so unfortunately we had to put her down.
Thank you. Okay, any more questions for her?
I was just gonna say, speaking of aggressive, you had 5 bites in 1 month?
Yeah.
Same dog?
No, luckily. But like a lot of those, it's, 2 dogs fighting over like a bone or something like that, and the owners stick their hand in or
Oh, sure.
something like that. So not necessarily aggressive dogs, it's just breaking up dog fights or something.
Okay, thank you. All right, number 11, emergency management.
Morning, thank you. As Lieutenant said, we had the 51st Berkey, so I was present in the command post, all of Berkey. Just recently, as of last week, we hosted a role of elected officials in disaster response and recovery training. I expected 5 people. There was about 30 people that showed up. So it was actually very, I hope, well received, and there was a lot of good information. I actually learned some things too. So there's a follow-up workshop that's going to be held April 1st, which we didn't realize was election day. So we'll be also hosting another one in the fall to make up for those who were unable to attend on April 1st. The morning session for that will be in Washburn County, and an afternoon session will be in Sawyer County here in this room. We had the Fire Association meeting in Coudray this month. And next week I'll be attending the Wisconsin Governor's Conference on Emergency Management and focusing a lot on flooding and tornadoes, safety and awareness. So, as far as dispatch goes, our dispatchers work alongside Bayfield Ashland County dispatchers. One of our dispatchers has been there 2 years in a row now working the command post. 2 of the Bayfield County dispatchers were brand new to Berkey, so it was a learning experience for just about everybody, but things ran very smoothly as far as that goes. We submitted a round 2 grant that was offered for radio equipment that is specific only to dispatch radio councils, not to the radio project itself, but to enhance the 800 megahertz when it comes to Sawyer County for the dispatch councils. And then we recently welcomed back Josie Trozen, who left to go out to Washington State, but has since come back. She's now our newest full-time, replacing one of the vacancies after Misty Eliff was hired to the court financial services assistant. As Lieutenant had mentioned, the call volume is down slightly from this time last year, from 1367 to 1299.
Okay, any questions? I attended Nicole's training, and it was very, very good information. I was really, really happy that I signed up for that. Thank you for that.
Is there gonna be another?
Another training like that one. There isn't one planned, but based on the feedback that we got, it might be something we do spring and fall and or yearly.
Okay. Any discussion on public safety, the radio network, Andy?
Yeah, I can just give you a couple updates. The GenCom is working on the design. Some pieces of information that we're just trying to kind of cross things off the list. We did have a conversation with the Wisconsin Department of Military Affairs, who runs the Wiscom network. We know that they're going to be needing a tower on the east side of the county at some point. But right now, the state is slowly funding that project. They're starting in southeast Wisconsin. They said it's too early to even for them to have a conversation about sharing a tower, or if we build a tower, will they locate themselves on it? So that's kind of crossed off the list. So that's in the Loretta area. So GenCom is proceeding with including talking to some existing towers to lease, or that will be a build option. And then as far as the WOJB tower, which is a pretty important piece of the puzzle, that's in the hands still of WOJB and now the Tribal Governing Board. They were working with WOJB is working with another company for locating cell, I believe it's T-Mobile, to put cell equipment on there. They have a proposal that they've had, and they want to settle that one first. And that, they said, as of last week, is with the TGB, determine if they're going to accept that, enter into that contract, then they'll know where and if we can locate on it. So GenCom is also looking at Plan Bs for that location as well. Build or lead. There's other towers in that area. Plan Bs, they looked at everything right now. Pipestone is a tower that we have. Could we increase the size of our Pipestone tower to cover that same area? There's a tower in New Post that's privately owned. They're talking to them about leasing, but both of those, I mean, WJB is a very tall tower and at a high point, so it covers a lot of territory. So at this point, there's not one option that would replace WJB. It might need to be 2 separate locations. But I believe the intent is to have everything ready for you at next month's meeting.
Does anybody know who owns or what the tower is just east of Stone Lake on 70?
70? We do know who owns it. Yeah, I mean, there's a registry. We can go in and look up any tower to find out who the owner is. They've looked at that, but that one doesn't cover, it's not in the right location.
I know I was looking at the zoning agenda and I see bug tussles on
Yep.
for one in town, Meadowbrook. but
Meadowbrook, yep.
I haven't heard that it's even on our town agenda yet, so.
Okay.
Oh, I just seen it when I was going over the agenda there the other day, so.
And so Bug Tussle is still in the tower business with one of their companies. So they're looking at Meadowbrook and Wooddale. And so right now we have GenCom and Bug Tussle talking about if those sites work, and then what would be the lease cost to get on those? Not a partnership, just how much would it cost to lease the tower?
All right. Any more questions? All right, we're gonna go on to number 12, child support report. Anybody here from child support? No? Well, she give us a report. Did everybody look at it? Any questions with it? If not, here we're gonna go to number 14, Criminal Justice Coordinating Council update.
So I put this on here because the MOU, I might have mentioned this last month, I did mention at CJCC. The agreement, the MOU we signed last fall was only basically backdated to February 1st of last year and expired January 31st of this year. So we've initiated a conversation with the LCO about re-entering to the MOU. What I told them is that since it's relatively new, we'd be happy to re-enter into the existing terms. We have not heard anything back on that yet. Or I guess I've heard back that they're talking about it. It'll go to TGB. The other information we did get though, when I sent the request was, I'm going to put this on the table here and it's on the table for CJCC, is a list of information regarding incarceration rates within our jail of whites versus Native Americans. And I'm not sure who put together the summary, but basically the summary is that Native Americans are 10 times more likely to be incarcerated than whites, which I believe they're going to bring this up as a part of the MOU. I know they've confronted our Justice Point staff when they come out to report to TGB as to why there's such a high incarceration rate. So I'm just putting it out there because I think that's, I've heard this. I think at some point I'm encouraging it to be a conversation at CJCC if we want to discuss it. CJCC is a joint group between LCO and the county.
Yeah.
That would be a really good place to get that on the table and discuss it. I don't have an explanation or answer. I've looked at it. Last year, I pulled the booking reports for our sheriff's department and the Hayward PD and the town of Hayward and LCO, and the demographics are pretty much all the same across all agencies. So I don't know that it's.
So Andy, they still have not decided to agree to this MOU?
We were good through February 1st of this year. Now we don't have one in place. That we agreed to one for last year. Now we need to agree for one for this year.
That was months after. They had to backdate it.
Yep.
So the same thing's gonna happen again this year. And they've got the information. They get the information every month from CJCC.
Yep, we try to give them, we're transparent, we give them information. They've asked for, as part of last year's agreement for Justice Point to give them a quarterly report. Justice Point communicates with them and asks, can they come out and give their presentation, or when does that happen? We did return the demographics breakdown on the jail report so that they wanted that on there, so we've done that. I think, frankly, we have a pretty successful CJCC based on, if you look at the outcomes of what's going on, the programs that have been launched, the number of people in our jail, the courtroom operations. So,
Yeah, I watched one of your meetings online and very interesting.
But the thing is, as the demographics go, they need, the numbers speak for themselves. And that MOU needs to get signed.
Yeah, and I put it on today's agenda in case.
Because of the demographics.
If you wanted any changes to the MOU, you have a copy of it. But since we just did it last fall, I'm not recommending any changes.
Right, we don't need any changes. They just need to sign it, put up the money because of the demographics as they are. And I think maybe I shouldn't go to that meeting. I'll get in trouble.
So we don't need to make an action on it, right?
Nope.
Okay. All right, any more questions on that? That, number 15, board appointed committee updates. Anybody got any committee updates they want to talk about? No? Okay. Number 16, correspondence reports from conferences and meetings. None. Future agenda items. Anybody got anything you want to put on next agenda? I don't have anything right now, Liz, but. No.
I don't know.
So, all right, I want to thank everybody for all the good information, the good reports. I appreciate everybody showing up. We are adjourned.